Geographic atrophy is a progressive, relentless disease that happens as patients get older. It is a multifactorial disease that is age-related, and there's a genetic component to it, as well as health and social issues. We also have seen that in this disease, complement system has been implicated in terms of inflammation, and this results in photoreceptor as well as RPE cell death. Geographic atrophy progresses is 100% of patients in 100% of the time. The disease will progress at a variable rate, but will always progress, and that depends on what kind of lesion patients have and the location of the atrophy. I started practicing over 15 years ago, and I still remember a patient that I saw who had perfect vision and was completely functional. She did have family history of GA, and she had seen her parents go blind. She was around 60 years old, and she asked me, am I going to go blind? And I did explain to her that this is a disease we cannot stop or reverse, and eventually it will progress. Now that patient is completely blind, she cannot function, she cannot drive, she cannot even get around in a room, and she needs help. This is a disease that will take the independence away from all our patients. This will lead to them getting depressed, getting frustrated. There's also a fear in the patients with geographic atrophy where they feel like they will be isolated from the society because of their vision. They feel like people don't understand how their vision has been impacted. So this is a disease that will take away the vision and independence for our patients. And over the last 15 years in practice, I've seen numerous patients who are completely functional and were able to do everything, and now they need assistance even to get in and out of the room, be able to sign their checks, be able to prepare their meals. So this is a big unmet need in our space, and this is a disease that we all need to address to have better treatment options so that we can give or keep the independence for our patients. Looking at how this disease can impact patients, 66% of patients with geographic atrophy will eventually become legally blind. 67% of patients will actually lose their driver license within 2 years of their diagnosis. It's a disease that progresses quite fast, faster than we thought in the past. And because we did not have any treatments available in the past, we really didn't pay attention to how it can impact patients. But looking at the data, it's a disease that moves faster than we thought in the past. And I think all of us need to make sure that we are diagnosing this disease early and making sure we are doing whatever we can to slow this disease down so our patients can continue to have their independence and ability to drive. I think vision is one of the most important senses that we have. And if you look at patients, they have fear of losing vision, and fear of going blind is one of the most feared thing they have. Around 88% of patients in a survey thought that eye health is very crucial for them to function, and it's one of the most important senses that we have. So as a physician, when I see a patient with geographic atrophy or early stage dry AMD, they have the fear of going blind. And many of these patients actually notice symptoms even if they have perfect visual acuity, because they will complain of scotomas and metamorphopsias and other symptoms. That's when they realize that there's something going on with their macula, and especially if they have a history of macular degeneration in the family, they have seen how their family members have suffered by losing vision. So clearly vision is one of the most important senses that we have. And as a physician, my goal is that we continue to work on possible treatments for our patients with macular degeneration where we can intervene early so we can keep their independence. Looking at patients with geographic atrophy, almost a third of the patients notice a decline in their visual acuity in the first few years. Looking specifically at the numbers of meaningful visual acuity loss, a recent paper showed that 40% of patients will lose 10 or more letters in 2.4 years. So that's 2 lines of vision. So let's say somebody's visual acuity is 20/40 and they're able to drive and they lose 2 lines of vision, they actually will lose their independence and won't be able to drive. Another number to look at is 3 line loss or 50 letter or more loss. This is very significant for our patients. And this study showed that 31% of patients lost that vision in 3 years or so. So when you look at these numbers, you realize how fast this disease progresses. And again, our hope is that we will diagnose these patients early and hopefully we can slow down their progression with possible treatment for this disease so we can continue to keep their independence and their ability to drive, and so that they can take care of themselves and not rely on their family members because their vision is handicapping them.